Hi, I'm Dr. Som, a board-certified plastic and reconstructive surgeon, and today we're going to talk about breast augmentation. So I have a couple instruments to help us discuss and look at and discuss breast augmentation, and those are breast implants. There are various types of implants: silicone and saline implants. Saline implants basically are like water balloons that we end up putting into someone's chest. Most commonly, people will end up using silicone implants, about 70% in the United States. Outside of the United States, that number is about 99% of people end up getting silicone implants. Why this large difference between the US and outside the US? Because in the late 80s, there was a scare about silicone implants causing a lot of autoimmune issues. So they were actually taken off the market altogether. And then for the next 10 years, there were extensive studies done and research, and they found that there was no correlation between silicone implants and a lot of these autoimmune issues that people were worried about. Now, that is not to say that some people do not have some sensitivity to implants as a whole, whether they're breast implants, silicone, or saline. And in those situations, those people should have them removed, which we actually do a fair bit of removal of these implants for some patients. And we're always here to help those patients when they need it. But the rest of patients who do not have sensitivities, most of the time, like we mentioned, here we have some examples of the implants that we do. You can see that they come in all different shapes and sizes. And that size and shape selection is something that we work with patients and we help decide what they need. The main things we look at when we decide what size and shape is appropriate for a patient is one of the main measurements, something called the base diameter of their chest, which basically is the footprint for a breast. So, for example, someone with a wide chest, this is not going to be an appropriate implant, right? It's not wide enough. It would not cover the entire area of a breast. Someone who's much smaller, getting this really large and wide implant would not be appropriate. So that's where these numbers come into play. The next thing is we look at the size and their projection. You can see the projection is very different between these two. But that again comes in, and the size in particular becomes an issue of what size someone is going from and what size they want to become. So one of the things that we do in the office that's been very helpful is we have a set of sizers. What are these? People come in and wearing their own clothes, their little inserts that go inside their bra, and really helps sample for them what size and what they would look like when they're done. Patients love these and they become very easy to use, and it really helps bring ease of mind for them to decide what size they want to be. Now, typically what we'll do is they'll pick a range of the size that they want to be or have an idea, but we have an understanding of what they want based on our team's understanding as well as what they tell us. So in the operating room when we're doing the actual surgery, sometimes that exact size they wanted may not actually look as good as they think. So we'll make some minor modifications to give them that perfect look that they want. Breast augmentation is an outpatient surgery. It typically takes about 1 to 2 hours. People come in the morning, they go home the same day. Where are the different places the implant can go? Either they'll be under the muscle or above the muscle based on where we decide to put them. And a lot of that depends on someone's natural breast tissue. People that have a fair amount of breast tissue can go either option. People that have smaller amounts of breast tissue typically will go under the muscle to make sure that you can't see the edges of the implant. So that's a very brief synopsis of breast augmentation. If you have any questions, please feel free to contact us. We're happy to answer any as they come up, either via email or in person. We're here for you.